Hi, I am Dr. Prashantha Kesari, a senior cosmetic plastic surgeon practicing out of Nypunya Aesthetic Clinic, JP Nagar, Bengaluru, India. All you need to know about rhinoplasty surgery. Rhinoplasty surgery is also known as nose job commonly. So, what you should know is, first, before you decide on surgery, you should know whether you really want a nose job or not. If you decide on, okay, I don't like the shape of my nose, you should be very clear what all changes you may desire. You should also be very clear about whether there are any breathing issues or you want to improve any of these functional aspects of nose. So when you are clear about what change may look good, then you consult a rhinoplasty surgeon. Rhinoplasty is offered by different subspecialties and many unqualified or subqualified people also. So, what all qualifications you should check in the surgeon you go for a rhinoplasty consultation? Point number 1, they should have an MBBS. Next, they should have an MCH or DNB in plastic surgery. They should have a fellowship in cosmetic surgery and they should be practicing rhinoplasty on a regular basis. This is very important because even a plastic surgeon who does rhinoplasty once in a year cannot give as good a result as a plastic surgeon who does it on a daily basis or a very regular basis. So choose your surgeons wisely. Check for plastic surgery degree, check for MBBS and their special interest in rhinoplasty. Once you choose the surgeon, you go with a list of changes what you would like to have and have an open discussion. Most of the experienced rhinoplasty surgeons listen to you and understand. I always suggest whatever you are wishing is practical or not. And if we make these changes, the nose will look like what you are imagining. So I help you make a decision based on what your wishes are and what is practically achievable, and with the help of software animation, we arrive at a common plan which may look very good on your nose. And when we do all this, we should not forget functional problems. If there are any breathing issues, they should be addressed together. What is the use of a nose which looks beautiful but doesn't breathe well? So aim should be always to achieve a nose that breathes beautifully. We take usually 2 consultations, we discuss a lot, and when we arrive on the common page, then we proceed with the surgery. So before you do surgery, what are all tests that are required for your nose job? We require all the preoperative blood tests and ECG and whatever the anesthesiologist asks. This is for general anesthesia, in which rhinoplasty is done most often. Apart from that, we need a scanning of your nose. It can be done many times with a simple digital X-ray, sometimes with what is called cone beam CT scan. Given a choice, my imaging of choice for rhinoplasty is a cone beam CT scan, which has quarter of radiation of a regular CT scan and gives almost 4 times more information than a regular CT scan. So then we finalize the plan and I make note of what are all important things and what is the actual surgical plan, and we execute it on the day we decide to do your nose job and achieve your dream together. How long does a rhinoplasty procedure take? Usually rhinoplasty procedure takes anywhere between 1.5 hours to 5 to 6 hours. It depends on the complexity of rhinoplasty and we will not stop till the results we have set out to achieve. Will I be admitted in hospital for rhinoplasty? Rhinoplasty can be done as a daycare surgery, which means that you come in the morning and go off in the night. Many times what happens is, if you are from a far off place or if you are from a different city or a different country, we ask you to get admitted and get discharged the next day. So it depends from where you are. If you stay close by, it can be a daycare surgery, no need of admission. If you are from a distant place, then better to get admitted overnight. Will there be any swelling after the surgery? After rhinoplasty, there will be lot of swelling. With piezoultrasonic rhinoplasty, swelling of the face and bruising is minimal, but the nose swelling will be still there. Nose swelling reduces over a period of weeks to couple of months, and the tip swelling lasts very long. When you can see the results depend on what all we have set out to achieve. If it is a simple hump or width reduction, then the results are seen even at the end of 1 week and they improve over the next couple of weeks. If you have set out to achieve a defined nose tip, then it may take couple of months. Many times it will even take 6 months. Right time to take bath after rhinoplasty is after 2 days. I ask you to wash your hair the way it is washed in parlor, like backwards, and body bath you can take from the next day itself. Face, we ask you to wipe with a wet wipe and use a very gentle cleanser from day 2. After rhinoplasty, you are advised to sleep with a little head up position so that the swelling goes off very fast. You can tilt to right or left side. We teach you a way to sleep without harming the nose job. And sleeping face down, we want you to avoid for at least 2 to 3 months. If you are very habituated to sleeping face down, we provide with a special pillow which allows you to sleep down without harming the nose. You can do exercise like walking, brisk walking, slow jogging after 1 week of rhinoplasty. Lifting weights, putting the head down, we request you to not do for about 3 to 4 weeks. And this can be gradually resumed on a gradual pattern so that you will not harm the rhinoplasty and you can be back with your exercise routine something like 3 to 4 weeks after rhinoplasty. Right time to start your work from home is after 3 to 4 days. If you don't have to show your face, you can start working from home from the 3rd or 4th day. And after 1 week, there will be no splint, so you can even take meetings where you have to show the face also. And you can start going out back to work after a week to 10 days usually. Usual activities, daily routines, you will resume after 3 or 4 days and gradually improves. And most of the work you can be able to do by the end of 7 days, even if you have taken rib cartilage for your rhinoplasty. What are splints used in rhinoplasty, external or internal? We use what is called external splint, which is custom made so that it keeps the bone and cartilages in place. We have placed them for about a week's time, and after that in only a few patients we keep it for the 2nd week. Most of the times outer splint is done only for a week, maximum 2 weeks time. Internal splint is done only when there is an extensive fist surgery and we keep it only for 24 to 48 hours. Most often it is an external splint for 7 to 10 days. How will be post-operative period of rhinoplasty? Usually day 1 to 3 you will have some swelling on the cheeks. Bruising with ultrasonic rhinoplasty is almost non-existent and there may be little soakage, that is dripping from the nose, how you will experience during a common cold. That ends at the end of 2 days and you continue to make rapid recovery. Pain is almost never there in rhinoplasty. It is more of a blocked nose feeling. Sometimes when we take the rib cartilage, there can be pain in the chest area when you move for a couple of days, and from 3rd day onwards that also is almost non-existent. So you come back for follow-up after 1 week. What do you see in the first follow-up after rhinoplasty? When you come for a follow-up after 7 days, I remove the splint which you would have put and the dressing of the nose, and this is the first rhinoplasty reveal. Changes are very evident in some nose jobs where we would have reduced the size and shape of the nose, and not so evident in areas like where we would have defined the tip and done some very fine maneuvers. So what you should keep in the first visit is all that you see, the drama you see in rhinoplasty reveal may not be there in all nose jobs. Yes, I want you to be practical. There will be lot of swelling in the first week and the first reveal, and to achieve what photographs you would have taken at the end of the surgery, it will take at least 3 to 4 weeks more, and for the results of the tip many more months. So please don't be disappointed at the first reveal. First reveal, if there are no problems, everything is en route to the result we have this one, please relax. So after first reveal, you are sent home usually without a splint and without a dressing, and you can breathe normally, and most of the swelling will start reducing drastically after. What happens during the 2nd week onwards in rhinoplasty? From 2nd week onwards, I teach you a way to massage your nose, how to clean the nose, and how you should be prepared for the changes that happen. Swelling drastically improves on a daily basis, and I ask you to massage. So once you come for your follow-up after 2 weeks, about 60% of the results of nose jobs are evident, and 99% of the times there are no other problems. We just have to be patient and wait for the results. So what I want you to understand is rhinoplasty is a journey. So it's not just a quick fix, but it's a journey which takes couple of weeks to months, in which I use all my skill to achieve the dream nose which you always wanted.